A left aortic arch with an aberrant right subclavian artery is technically not a true vascular ring, although we frequently see patients that present that have similar symptoms. So left aortic arch is the normal left arch that comes out of the left side, goes to the left side of the trachea, and then you have the blood vessel to the right arm that comes behind the esophagus and trachea and goes to the right arm. And again, what that does is it frequently compresses more commonly on the esophagus, causing esophageal symptoms, difficulty eating, or dysphagia as we sometimes like to call it. And that blood vessel compresses behind those structures, causing that compression. Now, technically, it's not a vascular ring because it only forms this structure. There's no other part of the so-called vascular ring structure that comes around anteriorly, forms a ring. So it's really a partial ring or a sling, if you will, instead of a vascular ring because it doesn't have that true connection to give a complete ring. So the aorta comes out to the left of the airway and esophagus, and then the right subclavian artery comes behind the esophagus, particularly compressing the esophagus in these situations, and comes up and goes to the right arm.
These particular patients often, if we find that their symptoms are severe enough, get a treatment in the form of usually a right thoracotomy, so entering the right chest through the back, and division and reimplantation of this aberrant right subclavian artery. This is accompanied by any potential esophageal mobilization and tracheopexy surgery if need be. Again, very custom to each patient and sort of tailored to their underlying symptoms.
So in this situation, we'll frequently go from a right thoracotomy, we'll divide that blood vessel, and then we'll reimplant that into the right carotid. And what that allows is to take all the pressure off the esophagus. We can then mobilize the esophagus. We can perform a bronchoscopy to make sure the airway is still fully functional without any significant malacia. And then that'll be a nice effective treatment for a left aortic arch and aberrant right subclavian.